Hey guys, I appreciate everybody taking their time tonight. I know most of you saw patients today and it's after hours and you're probably sitting in bed watching us. So always appreciate when people take time out of their day to learn something new, especially when it contributes to your patients in practice. Let me see if this will work. There we go. That's how I'm going to switch it. So just a little bit about myself. I'm from Brandon, Florida. It's right outside of Tampa. Went to FSU for undergrad. Go Noles. It was a bad season, but still bleed Garden and Gold. Did my pre-doc at Nova and my residency at UF Naples. Those are my three kids, my awesome wife, and a picture of the team at our office. We've been open for 6.5 years. Been in Apollo Beach, which is just a little south of Tampa. And I run Smile and Pediatric Dentistry, and I also run the Tampa Tongue Tie Center out of my office as well. As we're going through this, like Chris mentioned, like give us feedback, ask questions in the chat box, and I'll be able to answer more clinical questions or more particular questions as we're rolling through things. But I'm really an open book. You'll get my info at the end of the lecture, and if you guys ever want to reach out, email me, and I will get back with you soon and talk you through anything you guys are going through with your practices. We'll keep it rolling. So objectives for tonight, because you guys do get CE with this. We're going to understand benefits of scanning, explore real clinical applications, like how I utilize it in my practice. I'm not the best pediatric dentist out there, but I do like to kind of challenge myself to make moves in the office that's going to benefit my team, my patients, and the overall outcomes we have. So we'll talk about a little of that. We're going to learn a little bit about the scanning techniques, how to get your team on board with doing those things, learning the workflow of the integration of the device, which has been a very facilitating thing in our practice and allowing us to kind of make things more streamlined and just make our treatment day-to-day more predictable. And then finally, evaluate financial advantages. I would foresee that most of you are practice owners, and we have to keep into account expenses and cash flow and paying for things in the office. And whenever you're bringing in a new piece of equipment that is not cheap, you have to make sure you're doing it for the right reasons. So we'll talk on that a lot tonight and kind of just get rolling through things. So why am I here? Well, really, Chris asked me. No, in all reality, I've worked with NewSmile as a company since residency. I've always wanted to kind of learn the most up-to-date, use the best materials, make sure I am staying ahead of the game as opposed to falling behind. In June 2023, I finally pulled the trigger on the Allied Star wireless scanner. I was hesitant to do so because it's a big purchase. You know, in pediatric dentistry, most of our procedures and things we do don't cost a ton of money, which is a benefit of our overhead and not having to have a lot of that stuff. For me, I wanted to make sure I was getting the best impressions with the most ease. As I go through my day-to-day, when I saw an 8-year-old on my schedule with a full arch impression, and I knew that was a, 1- kid for a cleaning, that's going to be a no fun kind of appointment for me, my assistant, the patient, or the parent in the room. And that was one of my big reasons for wanting to get it. As a business owner, I had to think, how am I going to pay for this? And how is it going to justify me doing so? So I really just kind of did a lot of research on my own, talked with some of the NewSmile guys to get some insight, and talked to a lot of my general dentist friends who utilize scanners more often, orthodontists who are utilizing scanners more often, and started getting some comparisons out there. For me, it wasn't just the tangible ROI. Am I going to be doing scans of full arches and, full mouth rehabs that are going to pay for it in a month? No. But I wanted to make sure that I could give my patients a really smooth impression process, have the appliances that we get made at the labs fit perfectly, and then really introduce new procedures to my office. We are expanding our office right now. I want to make sure I'm continuing to grow the actual revenue side of things. And the scanners really opened my eyes after purchase to things that I can do in my office that I wasn't as comfortable doing before. The main reason I went with the Allied Star 200E, the wireless version, was really because it just seamlessly integrated in everything we did. Depending on your practice management software and how your office flows, it can really make that a smooth process and transition as you're getting your team members integrated. And I wanted to make sure that was a part of our daily workflow. I want to do as little as I need to do so I can focus on the patients, and I'm sure all of you do too. And I always want my team to have an easy process that won't have hiccups along the way, so we can really maximize efficiency in the office and just do a really good job of providing an awesome experience for our patients. I'm always committed to trying to use the latest tech. I like tech. I'm not techie. It's different. So I'm not really good at the nuts and bolts of, hey, I'm going to buy this and I'm going to integrate this laptop and I'm going to integrate this software. Like, I'm not as good tech-wise to do that. And the process, after learning more with New Smile and Voxel and NeoLab and everything that we'll kind of touch on tonight, it made it a much smoother transition. I did choose the wireless version because I don't like cords in my office. I like a very clean, kind of easy flow. So if other kiddos are running around or patients or assistants are moving around often, we don't have to worry about tripping over wires. And the size and kind of utility use of it, which we'll highlight as we go through this, made that a very kind of easy process and easy decision. Now, the biggest benefit for me was just kind of personal. I hated taking impressions on kids. I always did an okay job. We always got through the appointment, as all you guys know. Those tough appointments are rewarding at the end of the process. But really, I wanted to make sure we had a really good impression the first time, not having to take multiple impressions or not having an appliance that comes back that doesn't fit super well. Dental assistants do all of the scan. It is really simple for dental assistants to learn to do the scans. It is a learning curve depending on the age of your assistant, is what I learned in my office. My younger, more techie savvy assistants pick it up and just flow like they're playing a video game that they played a million times. My more seasoned assistants took a little more time to learn, but we worked hard to just say, hey, play with it. This is a toy. We started on typodonts and we played on each other during lunches and on breaks or before and after when we had some downtime. There's no more messy alginates. Like, I don't have a lab space anymore, and I don't have to worry about checking that impression, making sure it's clean, making sure blood's wiped out, making sure nothing's stuck to it, and packaging that all up and getting it to the lab. Another thing I don't have to buy anymore is alginate materials. I still keep some on hand just in case, but I have literally not picked up a tray or an alginate kind of mixer or dispenser since we have integrated the AS200E. And really the results that we get are phenomenal. Like, parents and patients are really wowed by it. Now, a lot of offices have these things, but a lot of parents don't go to the dentist as often, or they haven't been to a upgraded office, or they haven't been to an orthodontist who's using these. So you can be their first kind of touch on this kind of tech. And that is something that parents want. They want their doctor to be up to date on everything. And it's helped kind of just market itself in that sense. The efficiency has been the biggest change for me. Usually we'd have to schedule a bigger time lot for an impression. If it went smooth, hey, we got some chair time that we're just hanging out. But these impressions go very quickly and the accuracy is awesome. So you get impressions that you would never get on a patient with special needs or sensory issues, and you're available to just kind of roll through that process a lot easier. What we found is, hey, we can actually cut that appointment in half. We can toss another, quick appointment in, and instead of taking up 2 chairs to do some appointments, we have 1 chair and the ability to roll something else productive wise in the office, and just make for better revenue and better turnaround for the day. The turnaround time is quicker just because I don't have to have my team clean impressions, fill out a lab script, have me check the lab script. I still check the digital version, but it's a very simple process. And since it's all kind of already templated out, which you guys will see later, it just makes that a kind of no mistake, easy flow option in the office. It's also fully compatible with other techs via open architecture. And that's one of my big things in my office. I want everything third party accessible, not where, hey, if you use this scanner, you have to use this lab, or you're stuck doing just this kind of company. And then the thing that I didn't even really understand of how much it would facilitate my clinical day to day is the indirect banding that occurs. I used to seat all of my bands and push them on and take my impression, take the band off, put it in the impression, and send it out to the lab because I felt I had a better contour and a better fit with that band. The way they 3D print a lot of their indirect banding makes it a very, very just pop in, one try, no issues on the try-in, and makes it a much more comfortable fit for my patients, which we'll talk about in the future on this lecture here. Now, we talked a little bit about this. The cordless for me was huge. It being very light was huge. Lightweight was huge. I'm very conscious of my hands, my wrists, and my dental assistants' backs, wrists, positioning. I want them to be able to work for as long as I'm going to work so we can have a successful long career. When I was doing the pros cons of this costs this and this costs this, the laptop portion of it is included with this, which was huge because I didn't have to go research what do I need from a capability on the laptop side of things. Well, I need to reference that with my IT guy, have them order it, and then make sure everything's integrated. That was already like a cut and dry. Here it is. Really sweet. The warranty, 3 years is great. That's plenty of time to kind of learn it, make sure nothing's wrong with it. And it's been a workhorse in the office. We use it a lot, and I've never had an issue with any of the battery life or anything. And knowing there's a 3-year warranty makes it a little more palatable. The interface for the dental assistants to learn was very simple. It's just a couple clicks, and Jordan's going to walk you through some of that stuff in the future. And then we work on kids. Like most of these scanners, your Trios, all these other bigger ones, they're made for adult patients. I was hesitant to get a scanner for the longest time because of that one thing. I want this for my harder patients that can't take an impression. Mouth size and the ability to get in there and take a quality impression is harder when a kid won't open as much or there's limited range of motion. And the smaller tip adaptation on the scanner made it a kind of a no-brainer in my mind because it's made for our kind of practices. And there's no recurring costs. Like I always hate when somebody's nickel and diming me. Every month you have to pay for this subscription, and every month or every year you have to pay for this, or you have to update your warranty every 12 months. Having no recurring costs was a big kind of tangible ROI on my end. And as I mentioned, the open architecture portion of it makes it very simple. NeoLab is partnered with NewSmile on this. I ended up going with NeoLab. I also have utilized my old lab when I first started because you can send any scan. If your lab accepts that STL file, you can send it to them. So you don't have to change labs. But I liked the kind of full flow, seamless integration with NeoLab. So that is something that I did put in as part of my process. But it's not something that you have to do, especially if you have like a local lab that you like using. You can totally use this scanner for any of those capabilities. And you get your first 3 appliances free when you use NeoLab. So that's always sweet. This is kind of like their baseline comparison of things. When I was looking at these, the cost in my head was number one. Like we are investing in this product. So I wanted to make sure it was cost effective and that I could use it with any kind of company or lab that I wanted to. Really, it got down to the Medit versus the Allied Star for me. And the Allied Star checked more boxes, as you can see here. The cost effectiveness was more in line with what I was willing to chunk out. The size of the tips was the kind of icing on the cake. And that's what really pushed me over the edge personally. Everybody's going to have different procedures they're doing in their office, different needs, different patient bases. As a newer office, most of my patients are somewhat younger just because we're starting with newer families most of the time. But I do have teen patients that we use it on all the time. And this just gives you a nice little blanket comparison. I like this slide that Chris included just because you can get that snapshot in time of what's the pros, what's the cons, and what are you getting when you buy something. So step-by-step walkthrough, like we're going to kind of talk you through the scanner laptop setup. Jordan's going to touch on that. He is your man when you're trying to get this thing rolling, kind of what to do. And when you're starting this, you're going to have to learn something. It's just like anything new you put into your office. You're going to have people who challenge that new. And my team knows, like, if you're not moving forward, you're falling behind. So we're always going to make changes very consistently, and kind of push ourselves to get out of that comfort zone of what you've done for the past 5 years, 10 years, 20 years, no matter what you're doing. Troubleshooting during the scan is just practice. Like, the biggest thing we did was make sure our assistants were practicing on each other. They practiced on typodons first. They learned to troubleshoot together. You're going to find when you do integrate this into your practice that you're going to have certain assistants that get it quick. I made those assistants in my office like, hey, you're like the kind of team leader of this, and let's put a standard operating procedure in place. So if somebody has never been in this office, they could pick it up, push the buttons, and walk through it. It is very easy to learn. It's really just making sure you're recapturing if you fall off your scan, and you'll see some examples of that in some videos that we have. A lot of my assistants actually like scanning. Like today, I had a scan at the end of the day. It was like 4:40, and we had a patient with special needs, and we wanted to do something in sedation. But I was like, hey, let's have that appliance made beforehand, and they rolled through it within. It was like less than a minute because I went to my office thinking it was going to be a little while, and they're like, "Hey, need you to check the scan." So it was really sweet, and the parents were new patients and kind of wowed them from the start, which is always a good first visit in the office when you're trying to build those lifelong relationships. Adjusting your patient-doctor positions. You're going to figure out kind of what works best for you as you're learning to scan. Really, it's adjusting your patient to help you, just like we're taught in school, ergonomics, like make your patient lean to you. And if you have a tough patient, moving the doctor position around or your dental assistant around. And then the reorientation when losing the spot, the scanner makes it very easy to just kind of go back over where you scanned before, and it's going to pick that scan right back up, and you can kind of just keep flowing through the arch. I think one of my best tips, my Angelica, who's one of my lead assistants at the office today, was saying, the trick is do the whole outside arch and then do the palatal arch. Like keep it kind of like a nice like U rotation, and it's going to help you flow a little more because she's honestly better than me. You'll see the comparison between the two as we're showing you guys some videos throughout this. I'm going to let I think Jordan jump in and kind of walk you guys through this video. Let me move this real quick, Jordan, and I'll press play for you. And then you can just kind of talk over it. There's no audio on the video.
Yeah, perfect. So what I'm doing here is I'm just taking out everything that comes in the box. That's just kind of your manual. So this is the wired scanner. So what you're going to have there is just kind of the adapter to kind of plug in to power the wired scanner. So there's like your little base, and you'll see just taking off the protective caps, plugging it into the laptop. And that software that's open on the program, that's the AS Connect. I opened that just right before the video started, grabbed a tip, put it on. That's the regular size tip. So I started up a case just on the top right up there, click new case. I typed in, Jordan test. And then on the top right of that, you click scan. And that's all you do. You just pick up the scanner and get to going. The only difference really that would be between the wireless and wired scanner, where you see that cord kind of plug into the laptop and plug into the wired scanner. And that's, of course, your power source there. Where the wireless, you'll have like a TP-Link wireless adapter that you would plug in, and that's just kind of over Wi-Fi. And that way your scanner can be, of course, wireless and be able to take it around wherever it might be. But yeah, that's pretty much the full setup. You're able to just kind of plug it in and go, or, with the wireless one, same thing. You just plug it in and connect it down the bottom right there, and you're running into it.
Thanks, Jordan. And it really is that easy. Like Jordan, all the guys over at New Smile, the whole team will always be like, hey, call me if you need anything. I'm kind of a pick it up and play with it kind of guy. And as soon as I got in the office, I started plugging things in, reading, instruction manual, but just really plugging and chugging it. And it was within a couple minutes up and running and ready to roll. We started playing with it that day. So new tech is intimidating for some people, but can be fun, especially if you're a little more open-minded to getting your team on board with it. But I like how he just did that so easily. And I'm going to roll through. Now, this is my assistant, Angelica, doing a full arch scan. So she's rolling through maxillary mandibular scan, and she'll get a bite, which will give us our occlusion. So if you are doing something more than a single arch impression, you can gain all that information and use it for ortho aligners or, multiple arch appliances or some more phase one or orthodontic needs where you need all of that integrated in. So we have this sped up, and I'll kind of walk you through some of what she's doing. We have a little laptop kind of table with some of our stuff on it that we just roll around the office as needed. And she's rolling, and this is a mixed dentition patient, and she's getting me both full arches, and she'll grab the bite as we're going. She's very slick with it. She kind of captures everything in one swoop. When you start practicing, there's a little green box that'll show you where your head is, and as you're rolling through it. And he thought it was really cool, so he wanted to see it. And that's another fun thing. If you have an anxious patient, you can do part of it and show them it on the computer, and they're going to be a little more, okay, this is kind of like a video game. I want to play with this a little more. If you're going through it on your own, that little green box, if you lose your space, will turn red. And when that happens, you just roll back to an area that you did scan, and it's going to turn green again. And then, boom, I'm ready to rock and roll. And this is her capturing the bite. And he was biting up and down, wanting to look at the computer. But that's as simple as it was. I think that video was maybe 2 full minutes of gaining an impression with our patient bouncing up and down a little bit. But it is really that simple. And after that, we'll kind of roll through with the NeoLab team of how to formulate your script and have templates available. But within another 30 seconds, she could have that case ready for me to send to the lab, which is awesome. So by the time I'm done doing a hygiene check and high five in one of my patients, I'm back and saying, yep, go ahead and send that. That all looks great. And I'm on to the next patient. It's not me reading through things or writing things out because I've already pre-templated a lot of my details that I want my lab to know. And just really makes it a simple process in the office.
Hey, Casey, I'm just going to jump in real quick. Do you see that little adapter there plugged into the laptop there? That's what I was referencing in regards to the wireless scanner. So you can kind of see how the wireless scanner kind of looks in difference of setup. That's the only difference there.
Yep, that's it. And that just kind of stays plugged in there while you're working, and it's all wireless and connects. It makes it look sweet. Keep rolling here. Now, this was a video from, was this Dr. Jen, Chris?
Yeah, it was. Mm-hmm.
Yeah. And this was one of her assistants practicing for the first time and learning their way through it. And they're just doing what I recommend doing is practice on each other. Get that scanning kind of option down.
Go back to an already scanned area.
See how it turned red, and she just went back just a couple millimeters and it recaptured everything, and it just kind of flows in there really nicely. And these are things that we would do. Hey, you had a couple, like some SIBs cancel, practice the scanner. Over lunch, I'll buy you guys lunch, just play with the scanner all day. And the ones that get it fast, like I said, use them as your teachers because they're going to have better techniques and they can help guide. But it's a new piece of technology, and a lot of people are pretty interested in learning it, especially your assistants if they're engaged like you want them to be. Now, this is kind of our NeoLab portal entry as you're going through things. I'm going to let NeoLab speak on this a little bit more, but this is kind of what the interface looks like when you are getting into your NeoLab portal. You have a lot of already pre-templated appliances. So if it's something you're making often in your office, you can just have it all scripted up and ready, and then you modify it via your patient. What do they need? What are you going to do if you're modifying things, or you have a very specific case where you need to make sure they make room for a lower incisor that hasn't kind of fully come in? And just like any lab script, you want to make sure it's right the first time it goes out. But once you press send, it is much easier. I'm going to let the team over at NeoLab kind of roll through this. And this is a little video that shows you the click-throughs of things.
Hey, good evening, everyone. I'm Christian. I'm the owner of NeoLab. Thanks for having me. This is an interface that we built for our laboratory to be able to seamlessly submit your prescriptions with the scanner. So as it's rolling through, it's pretty self-explanatory here. You can choose all the different types of appliances that you want, the colors, the stickers. Whether we're indirect banding here, we could choose the different teeth. What other types of attachments you want to put on the appliance, styles of appliances. This happens to be a Nance button. You can hover over, you can see pictures of things, and then due dates. And here you'll be able to see on the due date calendar if you have other things going back to you on the same day. And you can piggyback your cases so that there is, save on shipping. So you can piggyback, 5 cases to go back to you on a Friday night instead of, 5 cases coming throughout the week. So this is a really simple process. Dr. Casey touched upon this just a little bit with the templates. So right at the beginning, you make your own templates. You can name them whatever you want. We don't see the names of your templates. So you can name them whatever is most familiar in your office. If it's a Nance button, if it's a lingual arch, if it's an RPE, if it's a Holly, anything. And then it's just as simple as, when the assistant's going to fill out the prescription, maybe the doctor could just say, hey, we're gonna submit for our standard Nance button. And you can go to the template, you click Nance button, it's going to ask you just a few pieces of information, one being the patient's name, and 2 being the due date, and then you hit submit. So you really can submit scripts in under 30 seconds once the scan is complete.
All right. And these are kind of the breakdowns as you open through those prescription forms. And as Christian hit on, they're fully customizable when you're like kind of putting your templates together. So if it's just a bread and butter and you don't care if it's a fancy color or anything else, we already have that all set up. And you can make specific modifications. So if you have a special patient who wants just glittery hot pink, on the palette, you can make that happen for them, just like any other lab. But the ease of the assistant doing this, I really haven't had any hiccups with any of the team putting these in, and all of the scripts look very similar. And if it's appliance you're rolling often in the office, it's going to be very fluid after the first submission. Like your team knows tech, they work on electronic practice management softwares all the time. We have a lot of integrated technology in the office, and this is just an extension of it. So when I spoke with NeoLab and kind of pros cons, like how much does your appliances cost? What's your turnaround? Being able to kind of like facilitate the deliveries and just make this ease happen, made it an easier switch for me from a cost benefit ratio, because there are labs out there that might do things like slightly cheaper, but you're going to have more remakes, or you're going to have back and forth with the lab because they don't love that impression and they need you to redo it. Or the appliance comes back not fitting well because that kid was super wiggly and the alginate pulled when you took it off before it was ready. So those are the kind of differences between having a full kind of integrated lab like NeoLab versus just a more traditional mom and pop style lab. Same thing with Nance prescription. They're all very similar. Just wanted to show you guys some of the differences between those. I like to use this for my team. And then also when I'm explaining things to parents, I have little printouts of these. Hey, for the team, this is the scan you need when we're doing these appliances. So they don't have to ask you, oh, what do I need to get? Is it one arch? Is it a quad? Is it both arches? Is it a bite? They have it kind of all ready to go. And obviously these are probably the most used appliances that we utilize in pediatric dentistry. There are a ton of things that you can do. And with the ease of scan, the biggest thing for me I've seen is just like the confidence in offering that to my patient. Typically, if it's like a really hard patient and it's something that I am like, yeah, I can do that. I do a lot of those, but it may not be the most conducive appointment for that insertion and or impression. I might send it to my ortho to do, I'm going to let them handle that. But now I can be like, yeah, we can do that for you, mom. The impression is going to take 30 seconds. We'll do it with a little wand, and the kids are interested, and they'll let us in there and get those impressions on like the heavy gag kids or the heavy stimulus kids. And we can still get a quality product with a simple process, which again, just leads to a quality patient experience in the office, which is huge. Now, band options, like when I started, I was still doing my doctor fits. This is kind of what I've always done. That's what I did in residency. That's what I did as an associate. That's what I did when I opened my practice. I always wanted it to be fully formed to it. With this, if you are doing it doctor fit, you will put the bands in, fit them, and then you will take them off and then scan and send those to the lab for them to put it on. If you're doing an indirect band, which I started doing that a little bit until I learned more about the 3D SLS that we'll talk about. I'm like, man, I'm not going to be able to get a band on this kid. That tissue's not going to feel good, and that kid's going to lose it in the chair. And just fitting the bands is going to be difficult. Even with placing seps, those kids, like you're trying to do like a Hall crown on. Placing a step can be difficult. And a lot of times with these tight contacts, you're going to want to do that. But that was still cementation. I had to think about that cementation appointment. Is that patient going to be super comfortable? Now, if they're sedated, doesn't really matter. But if they're awake, is that going to be a 30-minute back and forth, not liking the feeling of that going on the tooth and making sure it fits, then taking it off, putting your cement and re-cementing it in? That's an option, and I still do those sometimes. Most of what I'm doing now is the 3D SLS version. For this, it really just sits on like the occlusal kind of third cuspal coverage, I call it, to my assistants. And what's really nice is that appliance on the 3D SLS is 3D printed. If I mess this up, Christian, you can jump into this more, but they 3D print the model and they 3D print in aluminum the appliance over it. And the intaglio of that, and I have a picture of one of the appliances in the office, is like micro etched, and it's really, really retentive. So I was really concerned doing those at first because I was like, this isn't going to be retained. These kids are going to eat a Laffy Taffy. They're going to chomp on a Jolly Rancher. Like, this is going to pop off. I've had way less debonds with that in using like a Fuji Ortho Blue cement, like a traditional ortho cement. That is light curable and tack curable versus like just a traditional band and loop. And I still do a ton of traditional band and loops. I'm usually not going to go through the lab effort if I have a good kid or if I'm in IV sedation. I utilize the Neo Smile chair side kit because it is easy to use and they fit well. But when I have dual arch impression needs or bilateral impression needs, I go with this most of the time now, not only because the fit is phenomenal, like it drops in, there's no adjustments. I haven't had to bend one wire on a 3D printed appliance. And the cementation is easy. The only downside you're going to get is just like any other cementation is they don't like the taste of the glue, but there's no stimulation to the tissue, and it makes it a much easier cementation process. Even if it is a patient that I did sedation on to do the dental work, I can cement that appliance without having a big uproar in the office. And this one, it's just a scan and send, and it comes back perfect fit every time and allows you to just kind of plop it on. I really like it. It is a different cost depending on what you're doing. And that's something that you as a business owner can kind of roll through and understand more about. But for me, easy appointments, happy parents, happy patients leads to a better experience. And you're going to get a better long-term ROI on that when people tell their friends about it or are just going to stay with you for life because they love how easy you make things. And this kind of walks through those differences for that side-by-side comparison on your traditional fixed band versus your SLS 3D fixed. And they both utilize the same stuff. I use the just normal Fuji Sim 2 for my traditional band under the gum kind of placements. And I do use the Ortho Blue for the 3D fixed because I want that, like, I want it to set. I don't want to have a wait time where I'm having to hold it. And I was more worried about those debonds And when I started taking my bands off, like taking appliances off, I realized like that bond is very strong. You got to put some force on the band pusher, and much more force than you would from a resin modified glass ionomer that doesn't have that light cure component, because some of it will wash out as the saliva gets in. Now, I'm going to show you guys just some examples that I had at the office. As Chris mentioned, we kind of put this together quickly. So I was like, hey, I've got some things I can like pull up. I don't have a ton of like recall x-rays and pictures of patients to show you guys, but this is just a traditional band and loop that I 3D scanned the arch. He was a tough kid. He needed an extraction of S. And I was like, we can do this in the chair. You know, the little false confidence, nitrous and movie. I thought I could get us through it. We got our scan done very easily. It's a quad scan. Any kid can do this. They can be super tiny mouth, and you can get that peds head in there and get the scan. Got the scan, got through local, just completely lost them, and just decided, hey, we'll just do a quick sedation. Did the sedation, got the tooth out, got this cemented, perfect fit, and made for a much smoother process as opposed to fighting the kid for the extraction and then fight him again for the cementation. He had a big abscess. It was a hot tooth, and he did not love the actual dentistry, but getting this cemented was not an issue because it was a try on and then cement. It fit like a glove. I didn't have to modify it at all. Now, this is kind of what that lower lingual 3D SLS aluminum printed appliance looks like. It seats just like any other lower lingual holding arch. The kind of fit is always on point, and that's what I like about the integration with the scanner and 3D print. There's no modifications. You're not modifying wire or having an issue with seating against the lingual of those lower anteriors. And that middle photo shows you some of that like kind of etching that's on the inside. And when you get your loops on and kind of look at it, you can see how much surface area is built into that, which really allows for that true strong bond with the tooth and allows you to kind of flow through it a little easier. We'll get back to like kind of what I use this for. Most of the time, I'll use it when I have a kiddo that has that kind of thick distal operculum on the back of the tooth that is just full of food and plaque, and they don't love that kind of full ring going down on the distal there. This makes that cementation visit a much smoother process because you're not irritating that tissue and having bleeding when you're going through it. This was a tough case, tough kid, awesome mom, very engaged, abscess tooth, needed to get it out. And she had a thicker gum tissue on the distal operculum. Lower anteriors were barely erupted. I think 24 and 25 were in, and the laterals were not even moving. She was one of those. I got my first molars very early, and my anterior transition had not started very quickly. There was zero getting a band on the tooth just because of her behavior. We knew we had to go to sedation to get the tooth out. And it was like a quick turnaround because I had sedation like 4 days later. So I had to cement after. So I told mom, hey, I do not usually like doing these things. I like something fixed on the tooth. But if you're on board with trying and we can get a good cement, and I'm going to kind of crank on it after it's cemented to make sure it doesn't come off, let's jump in and try it. And mom was cool with it. Now, if I have a kid that's just going to let me do a band and loop in the office, I'm just going to do a chair side. But this gave us the option of getting a scan. We got that done pretty seamlessly. Do a sedation, get the tooth out, and then get the appliance back and get it glued on the tooth without a horrible fit of an appointment. No gingival pressure made her much more comfortable. I let her play with it on the model. I put it on the tooth, kind of gave that stimulus of this is what it's going to feel like. And it feels like nothing because it's just kind of touching the top of the tooth. And then we roll through the cement and get it cleaned up. And I did check on it a lot. Mom is very engaged and was cool with kind of keeping an eye on it, making sure it's there daily. And obviously I use that Fuji OrthoSim blue cement here for that strong bond on the intaglio. But I think this case is like a year old now, and I just saw her not too long ago, and it's still kicking and still hard as a rock. She's probably not going to like the coming off more than anything because that's going to be the most pressure she felt throughout the whole procedure. For this, it gives me the ability to not have to worry about ortho concerns. She's not a candidate just due to behavior. Couldn't place a traditional lower lingual holding arch due to the position of lower incisors. And it's at least going to hold that spot for me. Mom knows when the lower anteriors are in all the way, we're going to scan for a bilateral lower lingual and get a more solid space maintainer in there to hold the spot for. But it's like outside the box thinking, which in pediatric dentistry, I feel we do a ton, or you kind of need to navigate tougher cases and tougher families, and everything's case by case. But that was one that I did not think would work. I told Mom I'd give it a go, and it's working out well. This is another example of what those SLS or 3D printed look like, kind of cemented on the teeth. And it kind of gives you the idea of where the contour is. And you can see it's not dropping distal where that operculum would typically sit. So we did this for this kid, another sensory heavy kid who didn't like a lot of stimulation. And we had done work on him over the years, different sedations. And I was like, I never want to go to sedation for a space maintainer type situation. If it's a disease, I'm always willing to go. I do a lot of minimally invasive stuff at the office. So we've SDF this kid up a lot. But we needed to get a hot abscess tooth out. And this allowed me to do it. Got the scan beforehand and cemented this at the time of extraction. This was just on a follow-up where he let us kind of get bite wings. And I think this was like his first set of bite wings. So he was stoked. This is a patient that I just met a couple weeks ago. First time to the dentist. Never had anybody look in his mouth with the mirror. Fully blown out, number A. It was abscess, a little bit of tissue swelling. Got him on antibiotics and told Mom, like, hey, these are our options. We can do X, Y, Z. She couldn't stick around for any kind of treatment. So we got him on antibiotics over the weekend. About 5-6 days later, I was like, let's just get him in the chair and see if we can roll through a very quick, simple appointment. So this kind of shows you like the facilitating flow that you can roll through in the office. So I did sealants first because I wanted to make sure the occlusal anatomy was the right anatomy for when I'm going to make my scan. I used the SOAN to do anesthesia and did the scan right after the SOAN. So I had my sealants done, SOAN, anesthesia is complete, did my scan, and I think, is this me rolling through? Yeah. So this is me. So that's me putting my gloves on, and it's kind of locking up here, but you'll see I'm not as slick as my assistant Angelica is, and it's kind of glitching on the video, but he got through it. He's a heavy gagger. He gagged probably 5 or 6 times during this. He definitely would never have been a candidate for a full arch impression without throwing up in your op. And finished the scan, got enough of the palate to get that Nance button placed. And within 5 minutes, the tooth was out. So he was probably in the chair for 15 minutes. We did sealants, local anesthesia, impression, and an extraction. The mom left wild. The kid left super stoked and happy. He was very proud of himself. I was very proud of him. And these are the kind of visits that just make your kind of community reputation better, because you can take a kid who's never been a dentist, who has to have an extraction, his first dental procedure ever, and do it in less than 30 minutes and be in and out. And this one was really like 15 minutes. I was even surprised at the time in facilitation of that case. Oh, no, it just keeps wanting to roll. And this is just another example of I'm going to sedation. This kiddo is not going to let me do this dental work in the chair. We had some lower extractions to do and some just normal restorative to do. 19 and 30 were almost all the way in, but the bone was tight, and I knew I wasn't going to be able to get a full seated band without a lot of discomfort. So this is the kind of situation that I roll most of those 3D SLS kind of occlusal coverage bands on. Makes it more predictable, makes it more pleasant for the doctor and patient and parent. And for me, it's been kind of a game changer when we're treatment planning these cases and talking through the workflow with the parent and getting things scheduled correctly. My team likes it because people are happier and they're having to fight less. And I love it just because it's high fives all around afterwards. And there's less kind of issues with that back and forth. Now, ROI, like I've talked about that a few times. And as a business owner, you need to be conscious of it. We all have bills to pay and we have materials to buy, and we have to make sure what we're spending on our materials and technology and material and things in the office don't outweigh kind of what we're making. Tangible things that are like right off the top, you're going to have no more real trays or material costs when it comes to that. We don't stock a ton of that anymore. I have like one little drawer with some backup stuff in case I need to take an impression and can't do it with a scanner. I haven't had that come up, but I always like to plan for the worst. So we keep a little bit on hand. But I used to have a whole cabinet of things filled for our impressions with all the different size trays, the different materials, whether it was PBS versus alginate versus alginate. And then obviously the models that go with it. Now remakes are non-existent. I haven't had a remake from NeoLab yet, so knock on wood there. But it makes it a much easier thing with my traditional lab that I had used for the majority of my office time open. I would have not a ton of remakes, but I'll definitely have remakes like, hey, this doesn't fit, or I need to take a bird beak or a three prong plier and modify that bend. I've only had to do one bend on a band and loop type situation that I sent to New Smile or NeoLab. And that was because the kid delayed coming back for the cementation. It was like, 2 months post extraction as his sixes were coming in. So he lost a few millimeters and I just modified it and got it in there. You're going to save on labs fees by not having to do that back and forth a lot, which is nice. The chair time saved is, I think, the most kind of fast ROI from a business perspective, because you're going to start having the ability to modify your schedule and not have such big appointment slots for those and less doctor chair time for those appointments. And with the cementation being very predictable, as I know my appliance is going to fit for the first time when I put it in there, we can shorten that time slot. And I'm not going to have to sit there for 20 minutes fiddling with an appliance and modifying it, trying it in, modifying it, trying it in, and then cementing. It's one try in, fill it up, cure, clean, and you're out. The 3D model inventory was something that I didn't really think about. I do some phase one in the office, and obviously by law, we have to keep patient records for a long, long time. And you can not only use the scanner for all of your cases that you start, obviously that's going to be your storage for your models in a sense. There's no actual space in the office you need to put those. Any models you have, you can scan and put into that inventory. So you can offload a ton of space in the office storage wise, where you're not just having a bunch of white models sitting around that were sent to you from your lab. And that opens up inventory options. And like, I'm doing an expansion on the office, and my team, all they asked for was more storage. I'm like, what do you guys want? They're like, more storage. We need more places to put things. And that is a big issue in dental space. We have a very small square footage for the amount of people and things we do, especially in pediatric dentistry. And just being able to open up a whole nother kind of cabinet allows for a cleaner office and a more organized office. And that was something that I didn't even really think about until I started doing this more. And then obviously we've talked about the fast impression and delivery. We're not waiting on like lab scripts to go out or piling up and me not having time to like read through them and sign the copies. It's a button click and it's done. And then deliveries, being able to compound them and kind of, hey, bring all of those on that one date. You're going to kind of get a quicker delivery. Now, if I need to rush something, we just try to rush it, talk to the lab, hey, this is special circumstance, and kind of modify as needed. But those are kind of what you're going to see off the cusp when you're getting into utilizing this and the quick changes for your office. Long term for me is I wanted to use this to push our office to offer new procedures and be more comfortable doing those very reliably and being confident speaking on it. I always want to make sure I'm not over my head in doing a procedure that is not within my comfort zone. Being able to get a really good impression very quickly makes me just more confident in talking to parents about those procedures. And I second guess myself less because I know how to do it. On my teen patients, I do ortho aligners for very simple class 1 malocclusion cases, just to help parents out and kind of keep it in-house so they don't have to drive around town going to their orthodontic appointments. Parents find that extremely useful. I really didn't think I'd do a lot of it, but a lot of parents are wanting that as we've kind of expanded those options. And I'll let Jordan talk on that a little bit because I use OrthoBrain. It's just a company that I like because an orthodontist is behind it and kind of running the case with you. And they're pretty cost effective. But the cool thing with the Allied Star is you can use almost any ortho aligner. And I know Jordan's going to talk to you about that a little bit.
Yeah. So as far as, clear aligners go, anything with open architecture or open source, any company, you are able to. So a few of those, Clear Correct, I know Henry Shines, and then also like Angel aligners. Those are some that, I've spoken with who've used those. But any company that has open architecture, open source, which there is so many out there, just about most of them are. Main one really obviously that is not, it's like Invisalign, that is closed source. So that's kind of really the only main one you'll really run into or hear mostly about. But there's the vast majority of them out there are open source, open architecture. So you have an abundance of options as far as the aligners, clear aligners go.
Yeah. And that's another thing. Like if you're not doing those simple cases, if you're training ortho in residency like I was, it's up there. We know how to do it. It's something you can utilize, and that's going to definitely increase the ROI on the product. If you do 10 cases a year, you've already paid for it. So for me, that was like, okay, the simple things, the time saved and all of that was one of my justifications. But knowing that I'm going to be able to compound that revenue just by offering these different services to my patients was better. And then marketing, like we are a business. We should be marketing to our patients, letting them know what we have in the office and what we offer, what makes us different from somebody else in town. So you can highlight this on your socials, your websites. We're actually doing a full revamp of our website. And I was like, hey, we need like a page on tech. We got a fancy laser. We got this. We got the SOAN. Let's make sure parents know about that. And when I am using it in the office, I kind of talk it up to parents, and they're kind of wowed by it. And they love the kind of tangibles that they can see with their kiddo. But those mommy groups and parents talking, like those are your best referral sources. And that's who I'm always talking to the most. Those are the ones that I'm hoping it can go out for. And then referring dentists, like when your GP up the road who already trusts your dentistry, knows, like sees your work and those appliances fit when those patients go back to them, they're like, okay, like this guy's doing great work. Like a dentist knows good dentistry. And I always want, like, if my work's going back somewhere or even on to the next office, if they're moving, I want it to be good. And, it's one of those just peace of mind things, knowing like they're going to look at that and go, okay, they did a great job on that, even if it's just a simple space maintainer. So those are kind of your more long-term things you can think about as a practice owner when you're doing the nuts and bolts breakdown and your Excel sheet of like pro con list and all that fun stuff. Now, I'm going to let the new Smile guys handle this portion of things, and they'll kind of get into some of the purchasing options with everything.
Chris, did you want to speak about this or you want me?
All you, buddy. Go ahead.
All right. So when you actually purchase one of the scanners, that includes onboarding and training with the Voxel team, who we partner with on kind of the tech side of things and kind of train up your staff, integrate within the practice. You have free support and training as much as you need it. So you can make multiple appointments if need be with staff. So I know it can be really, really hard to, get everyone in one place and one sit down for, a meeting and training to do so. So if you need to make multiple appointments, absolutely. You may want to, do the training and you want to get a little bit more into the weeds. There's so many applications within it that if you want to, get into aligners or whatever else it may be, then you can do, training further along the lines for that kind of thing. So that's kind of how it's handled with the Voxel team. And then each scanner is going to come with 4 of the regular size tips. If you want the smaller size tips, we can, we do sell them for $80 for a set of 2. They are autoclavable, the regular and smaller size, for a minimum of 80 times covered by warranty. And be honest with you, if you put like a little cotton gauze just kind of over the mirror there, they're going to prolong the life of them by quite a bit. Each scanner and laptop come with a 3-year warranty. So you may see some scanners that come with a lab warranty on itself. If another scanner is included, or another scanner out there that has a laptop included, usually you won't see a warranty covered on that as well. So you'll receive the laptop pre-downloaded, preloaded, with all the software and everything you need. And that includes a 3-year warranty on it as well. Chris, did you want me to get into pricing at this point, or?
Yeah, absolutely. And the promotion as well.
Yep, sure. So the wireless scanner is
Keep going.
13,995, and then the wired scanner is at 10,995. Currently, we do have a promotion going on at the moment. If you purchase a scanner, either one, you can receive $200 off each sew-in or sleeper one you decide to purchase. And then another thing to hit on, just kind of from last slide, and I know it showed in the cost one earlier on, but there's no monthly fees. There's no storage fees, monthly fees, training fees, update fees, anything. It's doesn't need to be calibrated. So there's no kind of fees that you pay along the way. It's literally the price of the scanner, and you have free support, training, and everything going forward. So you don't have to worry about kind of getting nickeled and dime, along the way.
Thanks, Marty.
Dr. Casey, can you speak on Section 179, just brief overview for anybody that's not familiar with that or how that works?
Yeah. So first, I'm not a CPA, so ask them for financial advice. But I'd already kind of moved to the next slide. Sorry about that, Jordan. But in my sit downs with my CPA, every year I'm going to have some quarterly meetings, and then we're going to have an end of the year tax planning meeting, and we're going to talk revenue, expenses, what's our tax load look like, what have we prepaid. If your CPA is not having those conversations with you, I would maybe look into a more in-depth CPA, especially if you're a bigger office that has a lot of team to support, because the team is going to be a big overhead and you need to be conscious of those things. But if you're a successful office, you're going to have a lot of taxes to pay. And there are materials that you can purchase that are under Section 179 of the tax code that allow for a better deduction on your taxes. Typically, these are the ones that your CPA is going to be like, hey, if it's something you're going to use and it's going to be an integral part of your practice and you've been deciding it, if you had a really good fourth quarter or just a really good year, maybe you should look into purchasing something for your office. And this is something like we talk about every single year, because what are we growing to? What are we going to do? What have I been looking at tech wise? Is there anything I want to bring in the office? Hey, let's do that at 2024 before we get to 2025 and we roll into doing some other things. So it is a very common thing in dentistry if you're kind of got your fingers in the finances side of things. And it's something that I always think about towards the end of the year, that last quarter. I'm always, what am I going to get? Am I going to integrate this now, later, next year? But I would definitely have those discussions with your financial CPA advisor team and make sure you're doing it if you need it. I always tell my friends, like, don't buy things you don't need just to like lower your taxes, because that's still money coming to you. But if it is a product or something you're going to use that's going to increase the efficiency and revenue for the next year, pull the trigger, because you get a little better tax advantage on it as you're kind of planning for the future. And then this is just obviously info for your guys over at New Smile. Chris and Jordan, both super easy to work with, super knowledgeable on all this stuff. Very fluid in conversation. If I ever need something, I can email or text them or call them, and they're going to get on the horn with me very quickly to kind of help along the way. Because like I said, I will get support from my team, but I like to play with things and figure it out. But they help me through some of those troubleshooting situations. So this is their info. That's that little QR code. If you want like a demo and to learn more, scan that bad boy and get with them so you can kind of learn more about the tech they have and just the products that they offer. And then this is my info. That's my personal email. Take it down. If you want to reach out to me, just shoot me an email and just, say New Smile webinar in the subject line. I'm very responsible on emails. If it's a weekend, well, I usually try not to touch it so I can spend time with the kids and the wife. But during the week, I get in the office early and knock through a lot of my email lists. And then Neolab's contact is over there as well. And they've been a great group to work with. My team really likes the integration we've done with them. And they're just good resources for you guys.
Yeah, wanted to just reiterate that partnership with Neolab. Christian and his team are great. Christian, do you want to give a brief overview of just Neolab capabilities, things like that?
Sure. Full service orthodontic lab, full service pediatric lab. We started as Neolab in the orthodontic side. Neolab Junior is our pediatric division. We've been fitting bands for a very long time, doing indirect banding. So this whole scanning thing that came really to us back in 2011, we've been full swing with 3D printing, and like Dr. Casey was saying, that the SLS stuff is a printed stainless steel, and we can make any appliance that you want with that printed stainless steel. And if you do need to make an adjustment on that printed work, you can adjust it because it is printed stainless steel, and it's completely custom fit. So, and our portal system, our RX Wizard, is what we touched upon with the slides here. I'm happy to walk you through. Olivia is a great person to reach out to as well. She's a great resource when it comes to RX Wizard. It was built to seamlessly accept our prescriptions and make it super easy on the doctor side. So anything you need, please feel free to reach out to me as well.
Awesome. Thank you. I believe we'll go into some Q&A now. We have a few questions here for you, Dr. Casey.
All right.
Go ahead and you can leave that slide up for everybody to get your contact info, but we'll go ahead and start with some questions again. Just use that Q&A feature. We're here for you guys. So we'll sit here all night if you want to and answer questions. If not, that is definitely your choice. But we do have a couple questions, so we'll get into it. The first one is, can you do adjustment loops if you do an SLS LLHA?
I would say yes. I usually don't throw adjustment loops in there, but I know we can modify if we need to with a plier of some sort. Is that correct, Christian?
Correct. The answer is yes. You can add adjustment loops on those SLS appliances. Any appliance that you want to make, we can make with the 3D printed bands.
There you go.
Next question, I can answer this one. Yes, we do record all of these webinars, everybody. So they'll be posted on the New Smile website by the end of the week for sure. You'll be able to go back and reference the full webinar recorded version on the website. So that is available to you. Should be by the end of the week. Next question is, sorry, you may have mentioned, but how much does the lab charge for each space maintainer, or the range of pricing? How long is the turnaround time?
So cost-wise, I don't know that off the top of my head. They have a full price list that you can reach out to them for. And when I did my comparisons, it was variable depending on the appliance and who you were getting it from. For me, that small difference was worth the time, effort, ease, kind of quality of procedure to make it justifiable. And then turnaround time, usually 2 to 3 weeks, kind of like a normal lab. But if you do need to expedite, you're going to be able to kind of do that case by case. And typically we have no issues. Like, they're always there before our patients are there. So I've never had like a big delay from them, or having to wait, or not have an appliance in when that appointment was scheduled. So it makes it easy for scheduling too. Christian, anything to add to that from the Neolab side?
You nailed it. You got it all right, Dr. Case. It's good. The 3D metal printed stuff, we can do seven days in lab. So anywhere in the country in 9 days, 9 business days. The traditionally fit bands might take a few more days than that. But you're right. Within 2 to 3 weeks, 3 weeks being the latest, you'll get your appliances back.
Great. Last question, unless there's others. Just some more explanation on clear aligners, Dr. Casey, if you wouldn't mind. How you doing fabricating appliances compared to clear aligners.
Yeah, so the only real difference scanner wise is when you're doing those as part of your record taking, you're gonna need a full arch impression in the bite. So you're gonna do an upper full palate, you're gonna do a lower, and then you're gonna take the buccal bites so they get the occlusion. Orthobrain that we utilize, you have to also submit intraoral photos. So your traditional series of your orthodontic photos, full palate, full mandibular, your buccal bite, your anterior, your patient standing facing you, portrait style, and then a pano. Like there's no Ceph needed with their tech. And with Orthobrain, it's something where you send that scan and your records to them, and then they have an orthodontist treat and plan the case. So they'll do custom attachments and your buttons and kind of roll it through, obviously, the software for, hey, this is how many aligners we're going to do. This is how fast you're going to rotate them. And you can be specific as to if there's any like, okay, I want this, here, and I want this rotated. And you can just bounce back and forth with the ortho. I learned a lot of ortho. I didn't do a ton of aligners. I've taken the Invisalign course. I did some of those as an associate elsewhere. But it just gives me a little peace of mind knowing like case is going to track. And if it doesn't, I can kind of bounce things off them and we can modify the aligners as needed. I do way less of those. I really offer it for simple cases and patients and parents I like. But it's a good group that I've worked with. I had a couple colleagues that had utilized them in their practices as general dentists and been very happy with them. But I know, Clear Correct, Angel aligners, like they're very popular. A lot of my orthos use Angel now as opposed to Invisalign just because of the cost prohibitive and software prohibitive aspects. And for me, I wanted it to be like a simple process. So that's kind of what we use. But record taking is easy. Not having to like add anything big to your office. They recommended like, hey, here's a little point and shoot that's already like prepped for intraoral cases. And I purchased that, and that's our intraoral camera. Just kept it really simple.
Great. Question, Jordan, maybe you can answer this one. Question is, where are the scans saved? Do I need iCloud or OneDrive, or can they be saved directly on the laptop hard drive?
Yeah, really, really good question. So there's the program software is what's known as AS Connect. You receive a huge amount of storage that I'm pretty confident you'll never really run into, but it's all stored in the cloud through that. That's pretty much all it is. You don't need iCloud, OneDrive. Can they be saved directly on your hard drive? Yeah, yes, you can download it from that software. You can access AS Connect from any laptop. So as far as like doing the actual scans itself, yeah, we recommend doing that on, the laptop that comes with it because of the computer power that it takes to actually scan. But as far as going in and checking in on the scans themselves or accessing all those patient files and everything else, you can do that from any laptop because it's all stored within the cloud through AS Connect. Casey, have you run into anything like that as far as wanting to save it onto your actual one of your computers themselves or anything like that?
No, we keep it all on the software. Just keeps it easy and doesn't kind of take up space.
Yeah, exactly right.
Great. Next question is the resolution good enough to go back and double check for visual caries?
So yeah, it will show caries. Like if you wanted to use this as an parent education tool or a patient education tool, you can utilize your scan for that. Obviously, you're not going to use it for caries detection. You're going to use it more for visualization for patient or parent education. I wouldn't take a scan and go, that's for sure caries, just because like we're taught to do more than that to diagnose. But like if you look back through some of the slides and the scans that you see on some of those, like, okay, that's a, abscess broken down number A, you're going to see it there. And it picks up a lot. Like, if on that same scan where I had that kiddo in the chair that we did everything at once, you see my, little injection spot from the Soman, that one little red dot right there where I did one little anesthesia shows up there as well. So it's pretty solid on the visual. And you could definitely use it for just like a blanket if you're trying to show a full arch to a parent and kind of elaborate on, okay, do you see this broken tooth? Do you see this broken tooth? We need to place an appliance from here to here. Sometimes that's easier for them to visualize than looking at a panoramic and kind of talking through it. I'm very visual with my parents, and I try to like walk them through what's going to happen. But absolutely, you can see it.
Great.
I'm so glad you hit on that case aspect part of it, like a presentation tool. That was something that completely went over my head as well until I got feedback from you and some other doctors. That was great. To reiterate, please, if you have any more questions, please ask. I did want to touch on one more thing. Someone asked earlier, and Chris typed out the answer for him, but is the scanner available in Canada? Yes, it's available in the United States as well as Canada. Both scanners are.
I've got some more questions. Dr. Casey, can you go back to the prices slide?
Let me pop it back up.
Yeah. And while you're doing that, Christian, if you can answer this question, does Neolab ship to Canada?
Yes, we will ship to Canada.
Great.
This one?
You're not sharing your screen anymore.
Well, that's why you guys can't see it. Let me go back to share.
You did say he wasn't tech savvy.
Told you guys.
Yeah.
Here you go. Let me put it in the right view for y'all. See a little bigger. Are y'all seeing that now?
Yeah, we can see that now. Great.
All right, there you go.
So again, those prices include the laptop turnkey solution with the prefabricated laptop, and the 3-year warranty does cover the scanner itself and the laptop, and that is included in that purchase price, along with the 4 tips, autoclavable tips that you get. All right. Give it a minute or so. Dr. Casey, appreciate you hosting this evening. Anything else you'd like to add? I know you got some really good stories with utilizing the scanner and some patient experiences and things like that.
Yeah, no, I mean, it's one of those tools. Every time I bring new things in the office, you want to just play with it a lot. And I think that's what made my team comfortable, was getting used to it and doing it on each other. For me, it's a cool little something to talk about. It makes the impression a lot easier. Even today, taking that impression at the end of the day, the parents are like, nobody's ever really been able to get in his mouth and do things. And we showed it to him, said we're to take a picture. We did like a little example on a model, and then he opened up and we took an impression within a minute. So just those little intangible things that go along to making your day-to-day great, making your patient and parent experience great. It's worth it there.